What we do when we have a possible case of measles is we immediately begin working very closely with any facility or institution who may have had exposures. So one of the first things that we do is to immediately begin a partnership with that facility or institution and identify every single person who may have had close contact or exposure to the possible case. And again, this is something we do even before we have test results back. We want to be proactive. We want to get out there and protect the community. So as we identify these people and provide possible testing or possible prophylactic measures to these contacts, public health is doing something called a contact investigation. This is a core part of what we do. We are very aggressive and we're very quick when we go out into the community. We have an excellent staff that's well trained in doing these kinds of contact investigations. Right now, the recommendations to the public to ensure public safety and the stop of any spread of communicable disease would be make sure you're up to date on your vaccinations. Make sure your children are up to date on your vaccinations. Regarding the facilities or institutions or possible contacts to this possible case, I can tell you that public health is in the process of contacting every single one of those people, of working closely with the facilities to identify who they are, and of providing the measures necessary to boost that person's immune system or protect the public or provide any prophylactic measures that we can. If someone was exposed as a contact to this possible case, we either have or will be in contact with you. So if you're not contacted by public health, please rest assured that you are not part of the contact investigation. We are fully investigating all close contacts. If you're concerned about your own immunization record and you're wondering, how can I know if I'm immune to measles? I would encourage you to contact your primary care provider with your vaccination history. Along with your primary care provider and your vaccination history, they can assist you in making decisions about whether you may need another MMR shot, that's the measles, mumps, rubella vaccine, or whether you are already immune. I'm not going to go into the specifics of that here because it's a very detailed algorithm, but I can tell you that primary care physicians and the healthcare providers in our community will know how to walk through that algorithm with people who are concerned and want to know if they're immune. One thing I am going to recommend to the community is that if you believe you or your child has a possible case of measles, the first thing that you need to do is to call your healthcare provider. What we're trying to avoid is possible cases of measles walking into a clinic without having notified the clinic ahead of time that they were coming. And here's the reason for that. Measles is a highly contagious infectious disease. It's a virus, and it can be spread through the air. And so we're recommending that anyone who believes they have measles or their child has measles, that they call ahead of time so that they don't expose a potential waiting room or an office to something that's an airborne disease. Having said that, I can say that anyone who has been exposed to the possible case is being contacted or has been contacted by the public health department.